Hi everyone, we are from Group 8 and today we will be presenting about our topic anxiety and depression. So our group members consist of Adam Azril, me myself Arina Umaira, Alik Muhammad Farhan, Sarmin Trin, Muhammad Ishraf Shami and Ahmad Naufan. So these are the contents for our presentation. Now I'll pass it to the first presenter.
Assalamualaikum, my name is Alif. Now I will talk about the introduction to anxiety and depression. So what is mental health? Mental health refers to a person's psychological and emotional well-being. It encompasses the overall state of individual's mind, including their thoughts, feelings, and behavior. So mental health influences how individuals cope with stress, interact with others, and make decisions in daily lives. So why it's more than just mind? Mental health is more than just the mind because it involves a complex interplay of various factors that go beyond the cognitive aspect of individual. While the mind plays a central role in mental health, it is essential to consider the broader context and influences that contribute to a person's psychological well-being. Why it's crucial? Why it's crucial? Because mental health is crucial for several reasons, and its significance extends to individuals, communities, and societies as a whole. How to maintain positive mental health? Maintaining positive mental health requires intentional efforts and his holistic approach, such as self-care, manage stress, and seek help. And when to seek professional help? Knowing when to professional help for mental health concerns is essential for early intervention and effective support, such as when feeling difficulty to cope, difficult to concentrate, and thought of self-harm or suicide. Next is defining anxiety and depression. So what is anxiety? Anxiety is a natural response to stress and potential threats. It is a feeling of fear, worry, or unease about the future events, situations, or uncertainties. Occasional anxiety is a normal part of life, and it can be very helpful in certain situations, as it prepares us to respond to danger. However, when anxiety becomes excessive, persistent, and uncontrollable, it may develop into an extremely anxiety disorder. Next is depression. Depression, also known as major depressive disorder, is a serious mood disorder characterized by persistent feelings of sadness, hopelessness, and lack of interest or pleasure in activities that were once enjoyable. Unlike occasional feelings of sadness, depression is a long-term lasting and pervasive condition that can affect how a person thinks, feels, and behaves. Next, I will pass to the next person.
I'm Ishraf. I want to present to you all about problem statement. The purpose of the current study is to investigate how anxiety and depression affect public figures' mental health and well-being. So I will share to you all three main goals about the problem statement. Firstly is to investigate the prevalence and sign of anxiety and depression in famous people from a range of fields such as business, politics, sports, and entertainment. Second one is to investigate how anxiety and depression affect prominent figures' general mental health, including their level of emotional stability, sense of self-worth, and overall quality of life. And lastly is to examine the coping strategy used by famous people to deal with anxiety and depression, including the importance of treatment, support system, self-care routines, and lifestyle changes.
Next, data and statistics. The study revealed that 7.5% of respondents were having depression. Regarding depression anxiety level, it was found that 7% of respondents were having anxiety. It is important to note that the prevalence rate of mental health issues might differ depending on the population studied, the period of the study, and other factors. Though the percentage is modest, raising awareness can help to eliminate stigma and encourage early action. Knowing about anxiety and depression allow us to build a more helpful and understanding community. So raising awareness can lead to better assistance and mental health outcomes for those who are affected. Thank you.
I will be explaining about the theories of anxiety and depression. First, we have biological theory, which is this theory suggests that anxiety and depression may have a biological basis involving genetic, neurochemical, and structural factors. Next is cognitive theories. Cognitive theories emphasize the role of thoughts, beliefs, and cognitive processes in the development and maintenance of anxiety and depression. Next is behavioral theories. Behavioral theories focus on how learned behaviors and environmental factors contribute to anxiety and depression. These theories propose that individuals learn maladaptive behaviors or responses that reinforce their anxiety or depressive symptoms. I will also be explaining about the effects of anxiety and depression. First, we have emotional impact. Both anxiety and depression can cause intense and persistent feelings of sadness, hopelessness, guilt, irritability, and low self-esteem. Next, we also have cognitive effects. Anxiety and depression can affect a person's ability to concentrate, make decisions, and remember things. Next is physical symptoms. Anxiety and depression can manifest in physical symptoms such as headaches, muscle tension, fatigue, changes in appetite, and weight. Next, we have suicidal thoughts and actions. In several cases, anxiety and depression can lead to suicidal thoughts or behaviors. That's all from me. Thank you.
Okay, Assalamualaikum. My name is Ahmad Naufan, and today I will be sharing with you the diagnosis and assessment for people who have anxiety and depression. Okay, so people who are showing signs of anxiety and depression, it is best advised for them to seek professional help. For example, seeing a mental health professional. This includes the likes of psychologists, psychiatrists, counselors, and also therapists. So by seeing these people, you will get to understand better about your condition and get the help that you need. So secondly is they can use screening tools. In this modern age, there are a lot of online tests that you can take to see if you have the symptoms and the conditions of anxiety and depression. However, it is still best advised that after you do the test, you should still go see a professional. And lastly, when you are diagnosed with these kinds of illnesses, it is recommended that you join a support group, which is this is basically a group of people who share the same conditions with you, and it is a safe space for you to share about your struggles and your challenges.
The last part of this presentation is prevention and intervention strategies for anxiety and depression. So the first one is a person who is anxious most of the time has trouble relaxing, especially for anxiety. However, knowing how to let go of tension in the muscles can be helpful. Some of relaxation techniques are progressive muscle relaxation, abdominal breathing, and isometric relaxation exercises. Secondly, clinical interventions. Clinical interventions are managed by authorized psychological wellness experts or as students regularly through the counseling center. They can be administered individually or in groups and focus on treating specific mental health diagnoses. The last one is, at the point when people are depressed, they may not appreciate activities that they once adored. So, choose to participate in more activities that they enjoy by list the activities that you used to appreciate, plan one of these exercises every day, increment how much time accessible, ponder or record what you delighted in about, and converse with others about what exercises they like. In conclusion, the biological, psychological, and social factors that help form and keep anxiety disorders going were discussed. While depression is perhaps of the most well-known condition in essential consideration, yet is frequently unnoticed, undiscovered, and untreated. Therefore, all doctors ought to stay alarmed to evaluate for melancholy in their patients. There are a few evaluating devices for wretchedness that are powerful and possible in essential consideration settings. Thank you. That's all from us.